Thank you, Chair Sanders. For months, this committee, on a bipartisan basis, investigated the bankruptcy of Steward Healthcare and the impact of the delivery of care at its hospitals. This had nationwide implications. It affected patient care in more than 30 hospitals across 8 states, including Glenwood Regional Medical Center in West Monroe, Louisiana. I think Senator Romney also commented upon Utah being affected. Now, a thorough review of Chief Executive Officer Dr. Ralph De La Torre's management decisions is essential to understand Steward's financial problems and its failure to serve its patients. According to a report from the Centers of Medicare and Medicaid Services, a physician at Glenwood and West Monroe told a Louisiana state inspector that the hospital was performing third world medicine, quote, end quote. Because of management decisions resulting in limited resources at Glenwood, the state had to force the hospital to operate at 1/3 its capacity. One patient died waiting for a transfer to another hospital because Glenwood lacked the necessary resources to treat. Now, unfortunately, the problems at Glenwood are not unique. Audra Sprague, a nurse at St. Elizabeth's Medical Center in Boston, testified last week that because of understaffing, patients at St. Elizabeth's waited in the emergency room for hours and sometimes days for care. These delays further harmed patients, even leading to the death of a woman who had just delivered. We also heard that Steward neglected to pay vendors for essential hospital supplies. At St. Elizabeth's, it was so poignant. When a newborn baby dies, normally the nurse would place the child into a bereavement box. They did not buy bereavement boxes, and the nurses had to put these newborns into cardboard shipping boxes. Hospitals like Glenwood are also essential for the health and financial well-being of the communities they serve. Glenwood was the largest employer in West Monroe and West Ouachita Parish, at one point employing 9% of the community. At last week's hearing, West Monroe Mayor Stacy Mitchell testified that since Glenwood began its layoffs, about 450 people have lost jobs at the hospital. Now, to better understand, and by the way, this is despite Glenwood still making money. To better understand and hopefully prevent it from happening again, we sought answers from Dr. Ralph De La Torre. This is what our bipartisan work has been about, answers for constituents to inform legislative solutions. Unfortunately, Dr. Ralph De La Torre refused to testify voluntarily. As a result, the committee issued a subpoena in July. Up until September the 4th, Dr. De La Torre's lawyers indicated he intended to comply with the subpoena and testify. However, 8 days before the hearing, Dr. De La Torre informed the committee he would not comply with the subpoena. We responded to Dr. De La Torre, explaining why his objections to the committee's subpoena had no merits, and directed him to comply. Unfortunately, he defied the subpoena and refused to appear before the committee last week. Now, a witness cannot disregard and evade a duly authorized subpoena. It's unfortunate we've got to this point. But if someone shows contempt for the American people by defying a subpoena and refusing to provide answers, that is contemptible. And we are here to represent the American people. It is not just Congress he is defying, it is the people whom we represent, and not just in our states, but nationwide. I appreciate Chair Sanders for his collaboration in this bipartisan investigation. I think it's important, not just in this incident, but to send a message to those in the future who might say, oh, we don't have to listen to Congress. We can stiff them. Nothing will happen to us. We will, if we do nothing here, have no way to compel those in the future who, on a different occasion, should provide answers to the American people. I urge my colleagues to approve these resolutions to hold Dr. De La Torre in contempt.
Thank you.